Hi, I'm Dr John Fullbrook. I'm the Senior Partner at Clarendon Lodge Medical Practice in Leamington, and I'm speaking to you on behalf of the 8 practices in the Leamington Primary Care Network. What I'd like to do today, if possible, is to just deal with some of the queries and questions around the issue of the COVID virus and how it's affecting general practice and what we can do to help you. One of the really common questions we've been asked a lot has been about the self-isolation and how long you should do it for. If you live alone and you get symptoms of COVID, self-isolate for 7 days. If at the end of 7 days your symptoms have gone, except for the cough, then you're okay to circulate again. If you still have a temperature though, hold on till that temperature's been gone for about 3 days. If you live in the household with someone who's got symptoms, you need to self-isolate for 14 days from the start of your housemate's symptoms. If after 14 days you've had no symptoms yourself, you're fine. You can take yourself out of isolation. If on day 10, 11, 12 you get symptoms, you have to start your own isolation for 7 days. It might take a long time to get people moving again, but it's really important that we try and isolate this virus from the rest of the community, protect our vulnerable by taking these actions. So please, please make sure you're practicing effective self-isolation should it occur in your household. A lot of patients this week will have received notice from the government about shielding. Shielding is the way to look after patients who have got ongoing conditions which will make them very vulnerable to the effects of the COVID virus. This may include people with severe respiratory illnesses, people who've had transplants before, people undergoing active cancer treatment. If you've received one of these letters, please take it seriously. Please follow the advice there. And if you're uncertain what the advice is, look either on your practice website or look on the government 111 website, because there's much more explanation there. In simple terms, you need to stay indoors for the next 12 weeks. I know that sounds really hard, and it will be hard. It also means that people who live with you have to effectively practice social distancing within the household. So you may be having to eat your meals alone, use your own bathroom if there's one available for just your usage, and trying to make sure that all common spaces and shared utensils are washed thoroughly between you and the other people in the household. This will be a really, really difficult thing for people to do. And we know that there are some people who are vulnerable to being extremely isolated. Again, there is help for those patients out there, and the government 111 website has details of how to access that help. There are also lots of community support groups, and if you need help accessing those, it might be worthwhile, again, looking at the local resources in terms of the websites that your practices have, or if needs be, talking to someone at the practice to try and help signpost you in that direction. We have our own social prescriber, Dominic, who's been very much involved with these matters, and I'm sure he could help you too. It's really important when you're isolating at home to look after yourself, both physically and mentally. Physically, make sure you're eating well. Make sure you are getting plenty of fresh air with the windows open and the back door open if you can. Make sure you try and vary your activities a bit through the day so you don't get too bored or too stuck in your chair. On the mental side of things, it's important to vary what you do. Don't watch telly all day. Don't read a book all day. Try and vary it up. Watch telly, listen to the radio. Do a puzzle, read a book, do a jigsaw. All of these things will help try and alleviate some of the difficulties of being on our own. The other thing that connects us with other people is communication. So where you can, use any form of effective communication to keep touch with your friends and your family. For some people that might just be the telephone, which can be an absolute lifeline to you. For others with online access, it can be any of the social platforms that are available just to try and keep us connected. Use humour, make people laugh, make people think that they're with you in another way, even if they're not in the same room with you. If you have an elderly neighbour who's isolating, try and make sure you have some contact with them. You might not be able to see them face to face. You might be able to just talk to them on the telephone or talk to them at a distance over the fence. But it's really important to keep people connected at these difficult times. There are plenty of community endeavours that are trying to help people connected and trying to offer services to help where the state might not be able to provide. So look out for those. We have a social prescriber through the network called Dominic, who is helping out with a lot of these ventures and will be able to put you in touch with them if needs be.